Hi, y'all, and welcome back to Professor Truelove's Concepts for Nurses series. And I am Professor Terry Truelove. And in this episode, part of the respiratory concepts, we're going to explore arterial blood gases, what they are, and easy interpretation. Sources for this episode do include ABGs Medical Surgical Nursing and Sol's Introduction to Critical Care Nursing. An arterial blood gas, or ABG, is a blood test that measures the acid-base balance, or pH, and the levels of oxygen and carbon dioxide in that patient's blood. The test is used to check how well the patient's lungs are functioning, that is, how well they're performing gas exchange. Note that there is a difference between arterial blood gases and venous blood gases and capillary blood gases, which we will not be discussing in this episode. ABGs may be needed for a number of reasons, primarily for lung failure, but also for kidney failure. It is used in shock, trauma, after major surgeries, for uncontrolled diabetes, in people with asthma or COPD exacerbation, patients who are bleeding out, patients who have overdosed on drug, for metabolic diseases, and finally, for chemical poisoning, particularly carbon monoxide poisoning. Arterial blood gases are comprised of three components: pH, the partial pressure of oxygen, or PaO2, the partial pressure of carbon dioxide, or PaCO2, bicarbonate, abbreviated HCO3, and O2 saturation. In order to properly diagnose arterial blood gas values, it is important that we know the normal values of those arterial blood gases. And we'll start with pH. Normally, the pH is supposed to run between 7.35 and 7.45 in the arteries. If it is less than 7.35, it is considered acidotic, and at greater than 7.45, it is considered alkalotic. The respiratory component of arterial blood gases is measured as PaCO2. A PaCO2 between 35 and 45 millimeters of mercury is considered normal. Less than 35 millimeters of mercury is considered alkalotic, where greater than 45 millimeters of mercury is considered acidotic. A way to make it easier to interpret blood gases is to continue to think of CO2 as being carbonic acid, that is, an acid that is in the blood. So therefore, more carbonic acid, the more acidotic the solution is. The less amount of carbonic acid, that is, the less amount of carbon dioxide dissolved in the blood, will result in a less amount of acid in the blood. That is, the solution, or the blood, will be more alkalotic. The metabolic component is mostly dictated by the renal function, and that is the kidneys. Normal values for the metabolic component are the bicarbonate being between 22 and 26 milliequivalents per liter, with less than 22 being acidotic and more than 26 being alkalotic. During this episode, you will not hear me referring much to base excess, of which the normal values are -2 to +2. And the reason is, for the purposes of arterial blood gas interpretation, we can consider bicarb and base excess to move in essentially the same way. Lastly, you'll want to deal with the oxygen levels. It should be between 80 and 100 millimeters of mercury. So when diagnosing arterial blood gases, start with the pH. Is it normal? Is it acidotic? Or does it tend to be more alkalotic? If it is normal, then the ABG is normal if both the PaCO2 and bicarb are in normal ranges. However, if the PaCO2 or bicarb are normal, but they're opposite of each other, the pH can still be normal, and we would call that a compensated blood gas. If it's abnormal, your job is to find the abnormal parameter that is the same as the pH, that is either acidotic like the pH or alkalotic like the pH, and once you do that, you will find the source of the abnormality. For instance, let's look at this imaginary blood gas where we've eliminated everything but the pH, the PCO2, and the bicarb. We'll get to the rest later. In this instance, the pH is acidotic, so we have a condition of acidosis. But what is causing this? Well, we'll look at the two parameters or values. The PaCO2 is acidotic while the bicarb is normal. So this would be an example of respiratory acidosis. Let's continue by diagnosing respiratory alkalosis. Our fictional blood gas has a pH of 7.48 a PCO2 of 32, and a bicarb of 22. In this case, the pH is alkalotic. But which of the parameters is causing this? Well, the PaCO2, which is lower than normal, is alkalotic, while the bicarb is normal. So this is a case of respiratory alkalosis. And try to ignore that HCO2, that is obviously a typo. That should be saying HCO3. First, identifying whether the pH is normal, acidotic, or alkalotic works for diagnosing metabolic abnormalities as well. In this case, we have a pH of 7.30, a PCO2 of 37, and a bicarb of 20. The pH is acidotic, so again, this is a type of acidosis. But in this case, the PaCO2 is normal, while there is not enough bicarb, so the HCO3 is acidotic. This is therefore an example of metabolic acidosis. I mentioned earlier that sometimes you could have a normal pH, but that things like the bicarb or the CO2 would be opposite, and that was called compensatory or compensated blood gases. Let's talk a little bit more about these compensated blood gases now. I want to remind you that the body is always trying to correct itself or compensate for itself by trying to keep everything in balance. So do arterial blood gases. You can tell if the body is trying to compensate when the parameter or values are the opposite. For instance, the CO2 is opposite of the bicarb. That is, the CO2 is acidotic when the bicarb is alkalotic, or the PaCO2 is alkalotic while the bicarb is acidotic. If the pH is not within the normal range, but the HCO3 and PaCO2 are going in opposite directions, then this is known as being partially compensated. If, however, the same thing is happening, that is, the bicarb is opposite of the CO2, one's acidotic while the other's alkalotic, and the pH being normal, we would call that a fully compensated arterial blood gas. And again, this is because the pH is now in normal range. Going back to our fictional blood gases, let's look at an example of a partially compensated respiratory acidosis. In this case, our blood gas is a pH of 7.22, the PCO2 is 25, while the bicarb is 18. In this case, the pH is acidotic, so again, this is acidosis. But the PaCO2 is alkalotic, while the HCO3 is acidotic. This is an example of a partially compensated metabolic acidosis. Again, the bicarb and the CO2 are heading in opposite directions, but the pH is not yet in normal range. The body is trying to correct itself, in this case trying to correct the acidosis by blowing off more CO2, but it has not quite gotten there yet. We cannot yet say it's fully compensated because the pH is not in the normal range. If, however, we find that these two opposite parameters have caused the pH to go back within the normal range, we would call this fully compensated. In this example, let's look at a fully compensated respiratory acidosis. The pH is at 7.38, the PCO2 is 50, and the bicarb is 32. The pH is normal, but the CO2 is acidotic while the bicarb is alkalotic. Again, fully compensated respiratory acidosis. The body has corrected itself. Within the clinical settings, you have a lot of other clues for diagnosing these arterial blood gases. Their medical condition, any treatments or medications they may be on. However, for test-taking purposes, you may just be faced with an arterial blood gas. You may ask, how do I know what caused the initial problem and what corrected it? Was this originally a respiratory acidosis where the kidneys held on to more bicarb, normalizing the blood gas, or vice versa? How will you know if it's respiratory or metabolic? Well, look at the pH and make yourself an arbitrary marker. Make it exactly right down the middle. pH of 7.40 is going to be your midline. Now determine which side of normal your pH is on. So if you have a pH that is between 7.35 and 7.40, that tends to be more on the acidotic side. Find the parameter that's more acidotic, and that is your problem. It is a fully compensated that. So for instance, if you notice that your CO2 was higher than normal, but your pH was acidotic, that would be a clue that you're in respiratory acidosis that has been compensated for. In this example, we have fully compensated metabolic alkalosis. the pH is at 7.44, so it's normal, but it's between 7.40 and 7.45. The CO2 is 48, and the bicarb is 30. So you notice that the CO2 is on the acidotic side, but the bicarb is on the alkalotic side. Since we're a little bit more on the alkalotic side, that is, that 744, let's call this fully compensated metabolic alkalosis. And the reason we can use this cheat is because the body rarely overcorrects. The body doesn't like to squander these hard-earned calories. So unless medicine has done something to overcompensate, the body usually does not. And this is true in real life and on module exams and quizzes. So what interventions can we use if the pH is abnormal? The best way to correct the pH is to manipulate respirations, that is, change the minute ventilation. In a nutshell, increase the respiratory rate if the patient is acidotic, and decrease the respiratory rate if the pH is alkalotic. Remember that respiratory pH changes can be noted in minutes, while metabolic or renal changes in pH are measured in hours. So to review, in a normal arterial blood gas, the pH is normal, the PaCO2 is normal, and the bicarb is normal. For acidosis, if the pH is acidotic, the PaCO2 is acidotic, and the HCO3 is normal, we're looking at respiratory acidosis. However, if the pH is acidotic and the PaCO2 is normal and the HCO3 is acidotic, then we're looking at metabolic acidosis. If the pH is alkalotic and the PaCO2 is alkalotic while the bicarb is normal, we're looking at respiratory alkalosis. If the pH is alkalotic, the PaCO2 is normal, and the bicarb is alkalotic, we're looking at metabolic alkalosis. If the pH is acidotic and the PaCO2 is acidotic, but the bicarb or HCO3 is alkalotic, we have a partially compensated respiratory acidosis. If the pH is acidotic, the PaCO2 is alkalotic, the HCO3 is acidotic, we're looking at a partially compensated metabolic acidosis. If the pH is alkalotic, the PaCO2 is alkalotic, and the HCO3 is acidotic, we're looking at partially compensated respiratory alkalosis. While if the pH is alkalotic, the PaCO2 is acidotic, the HCO3 is alkalotic, this is an example of partially compensated metabolic alkalosis. When the pH is normal, but less than 7.40, that is between 7.35 and 7.40, and the PaCO2 is acidotic, but the HCO3 is alkalotic, we're looking at an example of fully compensated respiratory acidosis. If the pH is normal, but between 7.35 and 7.40, with the PaCO2 being alkalotic, the HCO3 being acidotic, that is an example of a fully compensated metabolic acidosis. When the pH is normal, but between 7.40 and 7.45, and if the PaCO2 is alkalotic with the HCO3 being acidotic, that would be an example of a fully compensated respiratory alkalosis. If the pH were normal but between 7.40 and 7.45, and the PaCO2 is acidotic with the HCO3 being alkalotic, we're looking at an example of fully compensated metabolic alkalosis. Once we have figured out acid-base balance, it is time to turn to the oxygen level. So let's not forget about that. If the O2 level, the PaO2 level, is between 80 and 100, do not make changes to oxygen at all. If, however, the PaO2 is less than 80, increase the FiO2, or the fraction of inspired oxygen. If the PaO2 is greater than 100, you should decrease the FiO2. That does complete this episode. However, there are more respiratory episodes to come. As always, I hope you learned a little bit. I hope you plan on coming back and listening some more. And if you are, we'll see you then. Take care now.